meeting. 7 o'clock, we have a public hearing for the Littleton Volunteer Corps appointment of Angeline Mcgregor. Angeline Mcgregor of 105 Foster Street to be appointed by the Board of Health congruently with the Emergency Management Director to become a member of the Littleton Volunteer Corps. Is Alex McCurdy here?
No, he had a conflict, so he was not going to be in attendance.
Okay. Did we receive any credentials or any information on Ms. McGregor?
No, we did not.
Okay. Does anyone on the board have a comment, question? Mike, go ahead.
Yeah, I just like to point out that as a matter of procedure and process, that at the very least we would need a brief resume or outline of a applicant's candidate background. If it's only for the record, we have nothing as far as I can make out except testimonials from Mr. McCurdy himself, which is very nice, but not quite the same thing as a very brief outline of, and we've required that of other appointments that fall within our purview.
As a courtesy, maybe you should ask her, and then she will provide anything you like to have.
That's been transmitted to her through Mr. McCurdy, and apparently Mr. McCurdy has declined to either transmit it or whatever. But if he's bringing the candidate here, it's his responsibility and the applicants to at least make the inquiry and follow up with it, which is standard for all the other committees in town, including the statutory ones, which we're one. So I think we can put it off until another time. I mean, this doesn't close the door.
Right.
So we can just do it another time. This is not a refusal or, we're just saying we can't proceed.
I understand.
Does anyone else have a comment or a question? Matt or Dan?
And I would certainly say I'm sure that the interim chief or Deputy Clancy have looked at background checks along with Mr. McCurdy, but yeah, having the simple knowledge of has their Corey cleared, some level of screening. I'm sure Alex would not put anybody forward that he did not feel comfortable and qualified, but it would just be nice to see some documentation or at least hear from them that, yep, Corey's been cleared, yep, their background has been checked, if they've been active, that kind of pieces. I did hear a little bit from the deputy chief the other night that the request was made, that he had seen it, but obviously did not have the information about her beyond her name. So it really went back to Alex as the team coordinator to follow up.
Okay, so we'll ask Mr. McCurdy then if he has more information he can provide us, and potentially maybe we can have Ms. McGregor join us for a meeting. Yes, Mike?
I was just going to suggest that that very simply we could transmit to her and Mr. McCurdy a copy that all we require is just a very brief summary of her background and experience, period. Mm-hmm. And,
Mr. McCurdy did allude to the fact that she had passed some sort of prerequisite training for the position. That's all I really know. Yep.
Yeah, their credentials, are not in dispute. I'm sure Mr. McCurdy, we're spending more time on this. Now, all I'm saying is that we need something for a record in case all of us get hit by a bus. Let's put it that way. That's why we have records that are filed. So there's a record that in case something happens at any end of the process, there's a reason why these processes are put in place for all boards and committees.
Understood. Is there a motion to continue this then?
I'll make a motion to continue. Yep. I'll second it.
Great.
Whatever.
Motion to continue. Roll call vote. Gino Fratelloni?
Yes.
Dan Kane?
Dan Kane, yes.
Matt Wason?
Matt Wason, yes.
And Mike Zeldin?
Mike Zeldin, yes.
And Kevin Baker votes yes. So we'll continue that potentially for our next meeting, which is
23rd.
March 23rd, assuming Mr. McCurdy and Ms. Mcgregor can give us some background information and summary of qualifications. So at 7:05, we have a public hearing for a deed restriction at 105 Mattawanakee Trail. The owner, Chris Kroback, is requesting additional finished rooms in his basement with the use of deed restrictions. Is Mr. Kroback here?
He is. He's being promoted now.
Great.
All right, I'm here. Can you hear me?
Yep.
Okay.
Yeah.
Yep. Thanks for hearing this proposal tonight. So basically, I'm proposing to finish off the basement area, which is presently one open room, split it into 2 rooms, but depending on how it's interpreted, it could be 2 or 3. And I want to go over those options. When I spoke with Jim Gareffi about it, he said that typically this can be approved. The issue is that the house is a septic plan is approved for 9 rooms. It's a 4-bedroom house. And by doing this, it would increase the room number. And it can be, he said that it could typically be approved with a deed restriction in the case when the room count exceeds by 1. So I think that requires the board's approval, as I understand. Yep.
Yeah, and we have your floor plans here. We see what you proposed. So basically taking the current playroom and carving out a section for a movie room, it looks like, which would, in my opinion, add a room down there, which would bring it to 10. And historically, this board has approved these sorts of things with the use of a deed restriction.
Mhm.
Why don't I go ahead and read Jim's comments? 105 Mattawanakee Trail. The purpose of a deed restriction is to disclose to everyone involved with the property, present and in the future, the capacity of the sewage disposal system. Using the sewage disposal system beyond its capacity may lead to premature failure of the system. The past 2 years have seen a lot of expansion of living spaces in homes. In my review of these plans, I've tried to apply the Title V bedroom definition in a similar manner for each request. I never doubt the applicant is going to use the house in the manner they present, but at some point they may sell the house and the next owner needs to understand the implication of restriction. The existing house has a sewage disposal system sized for 4 bedrooms, installed in 1964, passed a Title V inspection in 2019, and currently has 8 rooms, including 4 bedrooms. The site conditions should allow for the replacement of the existing system in the event it fails, as the area is served by town water and the soil conditions are good. The proposed basement floor plan divides the basement into 3 spaces, 1 enclosed, movie room, and 2 open spaces, den and playroom. The playroom and den are at the bottom of the stairs, and you have to pass through the playroom to access the movie room. Your decision to allow this depends on your comfort level with the plan, the site, and it should be consistent with other decisions you have made. Those are Jim Gareffi's comments. Does anybody from the board have a comment or a question?
No question. As long as the septic system is big enough to support.
Mike, you shook your head no. Dan or Matt?
No, I was just checking my headphone.
Oh.
Don't worry about it.
Well, it appears that there are 2 proposals, and from Jim's comments, he would favor proposal number 2 because he was looking at proposal number 1, if I'm correct, as having 3 total rooms in the basement, which would bring the count to 11.
So are we looking at the revised proposal for Board of Health review?
I assume that's what was referred to as proposal number 2, correct?
As
Correct.
opposed to the proposal submitted to the building department. Yep.
Right. Yeah. So I would look to revise that proposal to the building department if that's what was needed.
Got it. So you come down the stairs. On your left is that just open space now? What on the proposal for the Board of Health review?
Right now, as you come down the stairs in that proposal number 1, yeah, that is like an open space, which I'm calling a playroom.
Okay.
To the left, he means the den.
Oh yeah. Okay, as you walk down into the den, right now that is an open space with a fireplace,
Mhm.
windows, and a walkout door to the rear of the house, to the backyard.
Got it. Let me just zoom in here. Any other board member comments?
Oh,
Is there a motion?
make a motion to approve that
With the use of the
with
deed?
the read restriction, yes.
Is there a second?
So we're at 10 rooms. I just want to understand what we're proposing.
Yep, 10 rooms, based on the revised proposal for Board of Health review. We have the den, and then we have the movie room.
I see. So the proposal 1, where the movie room is walled off, would not be okay. But if that was, you essentially move the wall to the other side, that would be all right to have split it into 2 rooms.
So we're looking at the building department proposal, we're looking at the Board of Health proposal. You're confusing me now.
I'm asking to see whether the Board of Health is going to approve either one of them. Is the building department proposal as shown okay, or does it need to be modified? The fact that it has the den
Could we
and
put up-
open space, yeah.
Could we put up the floor plan under floor plan that basically meets the Board of Health requirement before we proceed? Because
Sure.
I've gotten confused again. So
Do you want me to share my screen?
please, that would be great. And just tell us what.
Okay, so this is the one submitted to the building department. And as you can see, it's sort of divided 3 distinct spaces here. And then we have this plan here, which separates it into 2 more distinct spaces with the den, the movie room.
And the one that we are, just for clarification, the one that we are currently have a motion on the floor is the one with the yellow markings, the previous one.
Sorry, it was my understanding we were looking at the revised proposal for Board of Health review, which would be this one here,
Okay,
which divides it into 2 rooms, which gives them a total room count of 10.
okay. So this is the one,
Yes.
is that correct? Okay, that helps. And do we have to explicitly mention this, or should we explicitly mention this in the motion and the deed restriction?
Sure. Why don't I go ahead and make another motion or update Gino's motion to grant the approval of finishing the basement into 2 distinct living areas, the den and the movie room, as proposed on the drawing here in the revised proposal for Board of Health review, given a deed restriction for a 4-bedroom home.
I'll second that.
All right, roll call vote. Gino Fratelloni,
Yes,
Dan King,
Dan Kane, yes.
Matt Wason,
Matt Wason, yes.
Mike Zeldin,
Mike Zeldin, yes.
and Kevin Baker votes yes. Thanks, Chris.
Thank you.
Can you still see my screen? No.
Nope.
Let's see. Packet. All right, at 7:15, we have a public hearing for 19 White Pine Street. Request for a variance by Jeff Hannaford, NDS. The request is to request for a reduction of setback distance from cellar wall of 20 feet to a proposed distance of 16 feet. Hi, Jeff.
Good evening. Jeff Hannaford, representing the applicant Joseph Pereira at 19 White Pine Drive.
Drive. I thought it was drive.
We're asking for a variance to Title V, specifically setback distance from a cellar wall to an existing leaching area. The minimum setback requirement is 20 feet. We're proposing a setback of 16 feet or a reduction of 4 feet.
Jeff, do you have a plan up that you can share on your screen?
I do. Am I able to share?
I think so.
Yeah. Can you, I'm not sure what you're seeing.
I see your dog.
Oh, hold on. How about that?
That's better.
Beautiful.
Okay. The reason for the variance is due to a proposed addition
Mhm.
shown here. There's an existing porch that'll be removed. Initially, when I saw the proposed plans, this new wall here is only 11 feet from the existing leach pit. A portion of this area is a garage, which is a slab on grade. So that only needs to be 10 feet. So that was fine. The issue was right in here, there's going to be a wall to separate the garage from a new basement area. With that wall initially going back to here, it put the basement within the 20 feet of that leach pit. After talking to the owner and the designer of the addition, they agreed to take this interior wall separating the garage and basement, stop it here, and turn and come back to the corner of the existing foundation. So what we'll have is a slab on grade here that turns and comes across the back with an interior foundation for the basement here. So what that does is it actually gives the owner a double foundation or an extra wall between the basement and the leach pit to prevent any effluent from making it into the basement area or within that 20-foot setback. What we've also done is the owner had a Title V inspection done last year. The system passed without any issues. The current owners, they bought it in 2015. A young couple, it's only been the two of them up until last fall. They've started a family, so they welcomed their first child last fall. The existing house is a single-story, 3-bedroom. Square footage is just a hair under 900 square feet. So as you can imagine, 900 square feet for a 3-bedroom is rather small. Raising a family, what they wanted to do is to try to expand as best they could. So they're adding some living space in this area, which will be a family room and a 1-car garage. What else I did was, besides the fact that it passed Title V now, I looked at the possibility of when they would have to upgrade the system. So in looking at it, checking the soil conditions in this area, I laid out a proposed leach field here that does meet the property line setbacks and the setback to the existing foundation, as well as to the basement, the new basement wall here. So this would be fully compliant. It's sized for a conventional system, the crushed stone perforated pipe type. As you probably know, you've seen the innovative alternative type systems. This footprint could end up being smaller, but I wanted to use the worst case conventional system. It will meet the setbacks. They would upgrade the tank, of course, and did have a fully compliant system for 3 bedrooms at some point in the future. So the addition doesn't take away from that. And the fact that they added a second wall to protect from the effluent migration, I felt that they were overcoming the requirement of a variance to provide equal or superior environmental protection. So we moved ahead with the variance request.
Okay, I'll read Jim's comments. 19 White Pine Drive, the applicant would like to expand the footprint and living space of the existing house. The expansion will not affect the capacity of the sewage disposal system, but the foundation of the expanded footprint will not meet the offset requirements of Title V, 20 feet required, 16 feet proposed. The proposed plan will require a variance to Title V. I don't see an issue with the proposed variance for the following reasons. 1, there will be 2 walls between the leaching area and the cellar space, and both will be waterproofed. 2, applicant has provided a location for the replacement of the leaching area in the event the current system fails and location would meet the necessary offset. Are there any comments from board members? Questions?
No,
I would just say thank you, Mr. Hannaford, for adding in that information for future planning. That's really thoughtful and helpful. Thank you.
You're welcome.
And well done, too.
Thank you.
So we'll entertain a motion.
seems like I wanted to make a motion, I guess.
Yeah,
Or there anything that she needs a good variance, I think, from the 20 to 16.
Is that a motion?
Yeah, there's a motion.
Is there a second?
I second the motion to approve the variance.
Okay, roll call vote. Gino Fratelloni,
Yes, sir.
Dan Kane,
Dan Kane, yes.
Matt Wason,
Matt Wason, yes.
Mike Zeldin,
Mike Zeldin, yes.
and Kevin Baker votes yes. Thank you, Mr. Hannaford.
Great. Thank you very much. Have a good evening.
You too.
You too.
So it is now 7:23. We have our COVID update with Katrina. Hi, Katrina.
Hi.
How are you?
Okay.
Good.
I feel like I'm a little rusty.
It's been a while.
It's okay. All right. Can you see my screen? No.
No. Yep, there you go.
Oh, that's not what I meant to hit. Like I said, rusty. All right, now you can see it. All right, so we're going to go right in. So this is the trends for Massachusetts as a state. So overall, we continue to improve. We're coming down from that high in the early January timeframe. Cases are continuing to decline. The current level is actually about where we were at the beginning of August, end of July of last year, which is awesome. Keep in mind that this number doesn't take into account any positives that are found on rapid at-home tests that are not followed up with a PCR. So this probably an undercount, but it's an undercount that is continuing to trend in the right direction. Test positivity is continuing to decline. It's 1.6%, and this is under that 5% threshold that we are targeting. So that's a good sign as well, and supportive of the low cases. Hospitalizations are continuing to go down as well, now around 327 a day. Again, similar to where we were in mid-August, late August, somewhere in that time frame. And deaths are now, we're seeing that decline there as well. We're down from like 50 a day to 19 a day. And so this lagging indicator is going to hopefully keep improving alongside of those other metrics. So this is where we were kind of like in late November. So this is definitely slower to come down, but we'll see where we are in a couple of weeks. And then if we're looking at cases by age group, this kind of gives us an idea of, if everyone's exposures are a little different depending on what stage of life they're in. So this is why this is important. So this is the end result here. And this last one is for the first 2 weeks in February is the most recent data that we have for this. This data will be updated in tomorrow's DPH report. The cases rates for all age group continue to decline and have done so through the middle of February, though it looked like in the last report that there was a little slowing of the rate of decline for some age groups, but not all. So 15 to 19, 20 to 29, and 0 to 4 age groups were not declining at the same pace the other age groups were. So that will be something to look at tomorrow. So for those first 2 weeks in February, the age groups with the highest rates were 15 to 19, 20 to 29, and 0 to 4-year-olds. We look into hospitalizations. Hospitalizations, like I said, continue to trend down from a level of the beginning of February. They were around 1,800 hospitalizations on February 1st. And as of March 7th, there were 291 patients in the hospital in all of Massachusetts. So this is a big decline, which is great. The proportion of people who are there because they have COVID, acute COVID symptoms that require dexamethasone, which is that steroid, is now lower. It's at 38%, where there's 62% of hospitalized patients are there, have a positive test. They could either be there because a recent COVID infection has exacerbated a medical condition that they already had and they need to go get treatment for. It could be that they have blood clots or are there for effects of COVID that are not caught in this definition of using dexamethasone. Or it could be that they're there for surgery, another procedure, and just tested positive. So there's that incidental group is a mixture of reasons. But it is wonderful to see the number of hospitalizations decline like it is right now.
Beautiful.
Yeah. Capacity is still on the higher side. Hospital capacity is at 90% of all medical and surgical beds. Those are occupied, and 79% of ICU beds capacity has improved. That 90% medical surgical bed is all beds for all reasons. So it could be that we're starting up surgeries again, and there's fewer staff, or they're giving staff vacation now that there's not a surge so they can rest. Our hospitals are businesses. They need to fill beds in order to make money to stay open. So that 90%, I'm not sure how to interpret that outside. But the good news is there's COVID cases are going down. We know COVID is not causing people to go to hospital as much as it used to be as a primary reason. And our capacity, especially the ICU capacity, has improved. So this is actually an improvement over where it was a month ago. When we look at other things that have improved, the sewer data is hit the lowest level we've seen since last summer. So like I said in a recent meeting, this is a form of surveillance that is not impacted by who's getting tested, what tests are getting reported in the data, things like that. So this is a good way to see if there are early signals that something might be changing. And currently in Boston, we don't see an early signal that COVID is starting to come back up again. So at this point, we are seeing levels of COVID in the wastewater like we did last summer, which is the lowest we had seen. This is great. Encouraging. And then looking at the new CDC metrics. So the CDC released new metrics to help individuals and communities make decisions about behaviors and policies. So these new metrics use 3 indicators. The first is to determine the number of new cases per 100,000 in the past 7 days. And they've actually increased the threshold to 200 per 100,000, whereas before high was 100 per 100,000. So this almost doubles that kind of case rate. And then once you do that and you determine if you're fewer than 200 or 200 and more. Then you look at the CDC looks at the number of a couple hospitalization indicators. So the one is new COVID-19 admissions per 100,000 over the last 7 days. And the other one is percent of staffed inpatient beds occupied by COVID-19 patients over the last 7 days. So when you use these together, then you get the low, medium, high, or the green, yellow, red coloring. So other things that they recommend communities take into consideration when making decisions is community up to date on vaccinations, the coverage of that, early surveillance information such as that wastewater data. Those kind of things can help inform local decisions as well. But we have seen that those are really high in our state, or wastewater is very low. So when we look at the map, Middlesex County is classified as low or as green. And then they give your information about what an individual or household level prevention behaviors would be, and a community level prevention strategies as well. So individuals are recommended to, at a low where we are, individuals are recommended to stay up to date on COVID vaccines. They improve ventilation of indoor spaces, testing if they're symptomatic, and follow isolation and quarantine guidelines. If an individual is immunocompromised or at high risk, they should have a plan for rapid testing, and also talk to the healthcare provider about other treatments and also how to protect themselves. So have a conversation with your doctor. And then community level prevention strategies continue to include making plans to distribute vaccines to achieve high level of up-to-date community vaccination levels, as well as equitable access, maintaining and improving ventilation in public indoor spaces, ensuring access to testing and at-home tests. So those are all things that we can work on during lulls if needed, if desired, I should say. So when we go into Littleton specific data, so for the 2-week period ending with February 26th, Littleton had 21 cases. That was down from 50 cases the week before. And then Jim gave us the sneak peek today with 19 cases. So essentially this 19 is similar to the week prior report. So we're kind of stable to where we were compared to last week's report. This 19 cases will be what will be reported tomorrow. And then when we look to compare ourselves to our surrounding area, this data is current through last Thursday's TPH report, so March 3rd. Littleton's average daily incidence rate was 15 cases per 100,000 people, which was continued to go down. And then all the other areas we track also trended lower. So our border towns, our surrounding community, our county, and our state all trended lower. And the range was pretty tight, was 10 to 17 per 100,000. And that's, again, similar. That was similar to, the first 2 weeks or somewhere in October. And so the state has continued to trend down, and is somewhere in like August. So hopefully we'll see this good reduction as well this next week. And then test positivity. Again, test positivity is the number of positive tests divided by the total number of tests conducted. This isn't people, and it should not be used as a proportion. But we had test positivity of about 3% as of last week's report on 3/3. And that data went through February 26th. So we'll see what happens when we get the data next week. But again, it's below that 5% threshold, which is giving us this is reasonable data to feel confident about. And the range for the other areas around us was 2 to 3%. So we're right there with our peers. All right. So if we look at some the cases reported by the schools, this is the data through last Friday. So through March 4th, the schools have stopped sending daily case notification letters to families. So they're now going to provide the information on a weekly dashboard, which is updated on Friday evenings. So you can see that this was the last week in January, we had 37, then we had a big decrease to 17, 13, 8. This blank is school vacation week because there was no data reported. And then we had 9 of the week ending 3.4. So that's almost similar to the week before vacation and the week after vacation. So we might have kind of leveled off there for a little bit. And we will see what happens when the dashboard is updated on Friday. I did reach out to Lynn Snow at the schools today just to get a feel for if there was anything huge changes that in the cases that we weren't hearing about. And she did say that the beginning of this week was, how did she phrase it? She said, consistent to what the schools have experienced in recent weeks with low or near zero rates. So I'm not expecting much difference on Friday compared to last week or the week before vacation. So we will see on Friday how that changes. So when we look at vaccinations in Littleton, the data didn't actually change a lot as of last Thursday's report. I know there was a vaccination clinic on the Monday. We don't always get that data into the system in time for it to be reflected. So we need to look at this tomorrow to see if it's just a data lag in terms of timing, or if this is really what our data looks like. So we'll see tomorrow. But as of last Thursday's report, 87% of Littleton residents had received their primary series, so that either one J&J or two of one of the mRNA vaccines, and another 9.5% were partially vaccinated. And notably the 5 to 11 age group was at 78% fully vaccinated, with another 14% partially vaccinated. So that age group is starting to catch up with the other age groups in town with some pretty good vaccination rates. And then when we look at boosters, approximately 85% of Littleton's fully vaccinated populations are eligible for boosters, and of which 75% of eligible residents have already received a booster, mainly in that older age bracket. The booster rates are higher, the older age groups. In total, for all of our population, regardless of whether they're eligible for vaccine or not, our booster rate is 55.8%, which is still above the state's average. So like I said, booster coverage is highest among the older residents, although I have to say that our 12 to 15-year-olds are at 54% boosted, which is pretty good given that they just became eligible right during the Omicron surge, the beginning of it. So these boosters are really important. Staying up to date on your vaccines are really important for keeping up the protections, especially against severe disease, hospitalization, and death. So it's really important to get these boosters when you become eligible. And then going into some of the public health kind of messaging things, I think with the changes across the state, in our town, in our schools and everything, there's been some, I've heard a number of questions. I've actually received a number of questions for people asking if they have to wear a mask at all, if they became a case, or if they quarantine. So I thought it might be useful to share the state guidelines for what to do if you become a case and you need to isolate. What are those? What is the guidance on that? So the state says if you are able to mask, so if you become a case, whether you test positive on an at-home PCR, an at-home rapid test, a PCR, however you become a case, you need to stay home and isolate for the first 5 days. And if you never had symptoms or symptoms were improving, you may resume most usual activities, except for those that do not allow mask wearing on day 6. So that's don't go to a restaurant on day 6. You have to wait till day 11 to do that activity. And you should wear a mask around others for 10 days. And they suggest also wearing one in your household to protect your household members. So that is if you become a case and you are able to wear a mask consistently and correctly. If you are unable to mask consistently or correctly, then you should stay home and isolate for the full 10 days. And if you never had symptoms or your symptoms are improving, you may resume your usual activities on day 11. And again, they recommend trying to wear your mask around household members. But again, you're in that category of not able to wear a mask, so do the best you can in that one. And then if you were exposed to somebody with COVID-19, there are quarantine guidelines still in play here. And they vary based on your up-to-date vaccination status and whether you're able to mask or not. So if you're up to date on your vaccines, and that's defined as you had your J&J. If you had J&J vaccine, you went and got a second dose of any of the vaccines at least 2 months after that J&J. If you had an mRNA vaccine, which is Pfizer or Moderna, you got another vaccination 5 months after that second dose. So if you're up to date on your vaccinations and you are able to mask, then there is no quarantine requirement. You do not have to stay home, although you are asked to wear a mask around others for 10 days, including your household. And it's recommended you test on day 5. So that can be an at-home rapid test or a PCR. It's up to you. And excuse me, you should isolate and test if you develop symptoms during that 10-day time period. If you are not up to date on your vaccinations or you are unable to vaccinate, if you are unvaccinated or you're not up to date on your vaccinations, but you are able to mask, then you are requested to quarantine for 5 days after exposure. You're asked to wear a mask around others for the full 10 days and recommended to test on day 5 and isolate and test if you develop symptoms. If you are exposed to someone with COVID-19 and you are unable to mask, it doesn't matter if you're vaccinated or not. The recommendations are to quarantine for 10 days after the exposure, and you can end quarantine if you test negative on or after day 5. And again, isolate and test if you develop symptoms. So I think the important thing to keep in mind here is this is, especially if there's someone in your household who is a case, you really want to do the best you can to prevent forward spread. So that's what these quarantine requirements or guidance is meant to do. And then one last thing is, so we're moving to that mask optional, mask as choice. And there are definitely people who are immunocompromised or whose health people are still wearing masks to protect themselves as individuals. I think it's really, and then also if you were a recent case, or if you're wearing a mask because you had a recent exposure, it's really important to wear the best quality and fit mask that you can during that time period too. So I've been saying this for over a year now. The best fitting mask and the best quality mask you can wear is the one you should be wearing. And the data is definitely showing that it protects individuals better, the better quality and fit mask you have. So if you choose to wear a mask, wear the best quality and fit mask you can get your hands on. A respirator style mask offers the best protection for an individual. So look for a good fitting N95, a KN95, or a KF94, something like that, that has the highest quality value for if you're going to wear one, wear a good one. Okay. And that's it for this week.
Thank you very much. Does anyone have any questions?
You did a good job. Thank you.
Thanks, Gina.
Good.
And
Go ahead.
thanks, Katrina, for all your work. It's nice seeing the trends finally close to where we want them to be.
Yeah, let's hope they hold here for a good long time. I think we could all use a break.
Mike, any news on variants?
The short answer is there's always news on variants. It's sort of a thing now. And keep in mind that there are other countries around the world that are in the middle of their version of a big epidemic, and including countries that New Zealand is an example, Hong Kong is an example. But basically, there's still places where COVID is going pretty fast. And so it's the more cases that you have, the more opportunities you have. All of us know that. The better chance you have of something coming to our shores sooner rather than later. And I'm glad that Katrina has been paying attention to the reports of viral particles in the sewage coming out of in Boston. And the reason that I'm very pleased about that is the fact that even though that the sewage that they collect is not ours, not even close, because I'm sure all of you know that it only takes the sewage, it always treats the sewage that come from people who are customers of the Quabbin Reservoir water supply. We're not. But when it turns out that if you do some measurements of what's happened, It turns out that that's a very good, we will see within 2 to 3 weeks following a change in the Boston sewage, we will see those particles, basically we'll see the disease arriving here in Littleton and the surrounding areas. So it's a very good sentinel, as well as a surveillance operation. And I hope we incorporate that as we move along and start approaching the fall. Efforts to get the company that does this kind of work to look at our sewage samples is basically, we're too small, we don't have enough people. And we basically, because we don't have enough of a sewage system yet and won't have one for a while. So in order to make the measurements useful, you need population, and you also need that population reflected in the sewage as well as everything else. We don't have that yet. But I'm sure we'll stay in touch with the company, and it could be as the technology improves, the requirements for larger samples, actually richer samples, will also go along with it. So that's the place where variants that basically make a difference are going to start showing up, including along with the old ones, as the ones we're more familiar with.
To follow up on the variant conversation, so Omicron, like the original Omicron, was basically 100% of all sequences that the CDC had reported out through, I don't know, a couple of weeks ago. And at this point, the sibling variant, the BA2, is in New England, it's about 25% of all sequences that are in New England. So it's actually rapidly growing here in New England, and that's a higher proportion than it is anywhere else in the United States at this point in time. The interesting thing to me, and I think it's important to keep in mind, is that the number of cases are so much lower. So like 75%, 25% are the new variant, but our cases are really lower. So we're not, unlike what we saw with the Delta switch to Omicron, where we were on our way up and the 100% came quickly and was exploding. We're not seeing that current same explosion with cases with the switch between Omicron 1 and Omicron 2, if you will. So we'll keep an eye on it. It's definitely throwing some other countries curveballs as they deal with it, but I'm not seeing anything right now that's telling me that we have an urgent issue to be acutely aware of and to respond to. So everyone should be aware, but I'm not panicked.
Yeah, we can set up a technique, I think, or a process if we wanted to monitor the sources of information about variants. They have a classification of how variants are viewed, and the only ones that make it easy they're called variants of concern, and they're the ones that have certain characteristics, such as the ability to basically turn off or impede our own immune system, and very often that goes hand in hand, maybe just a coincidence, with the ability to escape the response of the various vaccines that we use. That is, be able to keep the initial response of our immune system muted because they don't get recognized. What's unknown, since we're still out there, still collecting information, is the memory capacity of the human immune system through its T cell population to remember not only what it has seen, but which works to our advantage is that not all T cells are the same. These are the memory, I'll call them the memory cells for identification. But very often, after the initial immune response, T cells develop a variety where basically they're almost as random, as it were, in their characteristics as multiple variants of the virus might be. So very often, all you need is one T cell, a memory cell that by chance alone was formed by chance alone, that happens to recognize the sequence sitting on the surface or the spike of a virus. And the next thing you know, from one, you get several million and you're protected. No guarantee. So all this comes out of the vaccines that we've administered. So we'll know by fall, how things are going. But by the way, that's the secret of success to some extent of the flu vaccine.
Interesting.
So everything comes back.
That's interesting. Katrina, we've been working on sort of a dashboard for local information that we'd like to get your input on and potentially, finalize it and post it so that we have sort of a rubric to work off of, should situations change. Have you taken a look at that or seen it or?
No, I have not.
Okay, well, we'll send it to you and then, maybe take a look at it in all your spare time.
Katrina, you saw an early draft.
I think you shared something with me, but I haven't seen it.
I got your input from that one, so I'll send you an update one now.
I have a follow-up. If that's the same one, I have a follow-up comment to my prior comment, so I will get back to you.
Okay. But we'd love to get something like that just implemented on the website and out there so that, it's out there for public knowledge and what's going on. Go ahead, Dan.
I know we saw an early version a few meetings ago from Matt. Can you circulate whatever you currently have to all of us as well, just for some input so we can see it and maybe provide input as well before we
absolutely
before the public for a final approved to go on the website?
Yeah, I think we should have a discussion on it at our next meeting, actually.
Yeah, if you can circulate those, we can see it. And
that'd be
kind of cook on a little bit longer than just during the meeting.
Sure thing.
Janet, would you mind adding that to our agenda for the 23rd? And we'll all take a look at it and bring comments to that meeting.
Okay.
Thank you. Well, thanks, Katrina.
Welcome.
Great job as always. See you soon.
Thank you, Katrina. Be safe.
So we have our next discussion is on the residential trash haulers, and it's unfortunate Jim is not here because he was going to speak with the folks over at Harvard who have implemented their regulations, and he was going to get some feedback on things that are working, things that are not working, and give us some insight onto where we might want to tweak or change some of those things just based on the implementation of those regs. So I will, if it's all right with everybody here, I was going to send Jim a note and just say, can you bring some feedback? Send us an email with the feedback from the folks in Harvard so we can put our ducks in a row and get something implemented. And in regards to the list of trash haulers, I have a short list here that I've just found by doing a quick Google search. Does anybody have some insight on the best way to come up with a list, or do we need to, would you rather get the regulations in place and then come up with a list and send that list a notice of the regulation? Mike?
Are we in effect saying that at the moment there is no regulation of trash hauling in Littleton? Or that we do have them, and therefore, in order to haul trash, you have to basically, I would assume, make that fact known to either us or other kind of agencies in town. So my question is does there exist, even if it's outdated, a list of haulers? I mean, you're able to find it.
I only found it by Googling who's out there and the trash cans I see driving down the street.
Yeah, and just keep in mind also that there's been a recent merger between two of them, and I don't know who else is hauling without marking their trucks, but they still may be allowed to do it for all I know. So I'm just wondering if there's it's worthwhile asking the question of whether or not there already is however outdated a list.
I don't believe there is a list of vendors. So
it's anything goes.
Yeah, anything goes.
Okay.
We do have a permitting requirement. However, it does not appear that it has been enforced in anyone's memory. So there is a requirement, but it is not enforced. I think we probably should be running this in parallel, working on, drafting off the regulation, but also certainly as part of that process, identifying those haulers who are currently working in town so that we can, as soon as the regulation is ready to be public hearing, voted, posted, go into effect, that, we kind of create a a process for those folks who are already doing work in town to be notified in a timely manner of the permitting requirement, the application requirement, and figure out whatever window we want to provide those existing agencies to come into compliance. And that's certainly not saying that they're not currently in compliance because we haven't enforced it. So I'm not saying it that way, but once our regulation is in place, give them some reasonable time window to go through the process. But yeah, I think we do it in parallel, and certainly Google and keeping our eyes open around town is probably going to be our most effective first round list. I admit I have to Google. I'm not sure if there's a statewide. I'm sure there is an association, a professional organization around recycling and waste management for the commercial folks, and that also may be a route notify the professional organization that as of the date of the regulation, this will be required for the town of Littleton. So any of your members who may be working here in town, if we don't get to them directly, then that may be another route to get to any folks who either are working in town that we have not recognized or who are interested in coming forward and becoming a vendor in town.
That's a good idea.
And I'm pretty sure the state, under the environmental protection sector of the state, also probably has regulations affecting trash and other disposal mechanisms. And I know there are rules about that. The other minor thing that we all keep in mind is that the town itself runs a dump. It sounds like a social event, but what it really is basically if you have.
Don't say dump, transfer station.
I'm sorry, transfer station of trash and other materials. And basically they're in competition, as it were, with commercial haulers. So we ought to keep that in mind, because the transfer station is a transfer station. It doesn't go from house to house. You have to bring it to the transfer station. So it's a different but distinctive service.
Yeah, I think the town should buy a truck and just pick up everywhere. That would make life.
I'm sorry?
I think the town should buy a truck and just haul it to the transfer station. Everybody.
Transfer doesn't have that capacity.
I know.
So if we think there was a permitting process, do we have permits in existence, do we think?
I don't believe so. No, and that's probably a town clerk question. As a business certificate, that's probably where that's on file.
Because that might also be beneficial for an introductory letter to the haulers we know about to say, here's what we're doing, and by the way, we cannot find a record of yours, or here we do have a record of yours. Maybe they could also provide something in return if they say we found our paperwork from 1978.
Right. Yeah, that'll be on my action item list to contact town clerk too, and see what records she has for people in that sector. So if everybody's all set with that, we can move on to the Memorandum of Understanding. And does anyone have comments on that? I know we didn't see a draft until the day before our last meeting, when we had a couple members not in attendance for that, so we haven't really had a chance to talk about it. Does anyone have a comment off the bat? Go ahead, Mike.
First of all, I want to make sure that everybody here has had an opportunity to see the quote draft that was prepared and submitted to the select board.
Yes.
Dan, have you seen it? Matt, have you seen it? Gino, have you seen it?
Nope.
Okay. Then I think it's going to be difficult to discuss if you haven't seen it, but I think it sort of is an indication of some of the issues that we're facing here. It's basically this: on the assumption that the town budgets, it looks like we're heading in that direction, budgets a position for public health coordinator coming whenever the hire can be made. Then the question arises, who is going to have, or what is going to have, supervisory responsibility for basically supervising that individual, the health coordinator. Right. At the moment, what's been discussed and proposed, that's the so-called Memorandum of Agreement draft was submitted, is to more or less follow the formula that the select board follows, which was they basically assign to the town administrator office the responsibility of providing supervisory input and sitting in on, therefore, on the evaluations of the employee. And a memorandum of understanding exists, therefore, between the select board and, let's say, the Board of Health, that, shall we say, allows certain people to, as it were, carry out, the select board and the planning board allows the planning board, for example, to have someone supervise the work of the planning officer in town. In this case, it's the buildings commissioner office. So in other words, the planning board itself doesn't have day-to-day, week-to-week, month-to-month supervisory responsibility for the town planner. It's the town administrator. Now, in the Memorandum of Understanding, there also exists a wish or desire that the administrator can turn around and assign that responsibility to someone else. And someone else in this particular case could be the building commissioner. So in other words, if we have a memorandum of understanding that says the town administrator has supervisory responsibility or carries out under our policies, and then turns around and says, I'm very busy, or I want this really to be carried out within the building department, this function can be carried out by the building commissioner. So it'll be 2 steps away from the Board of Health. So the real question we have here is, and the other piece that came up along with it, although it's separate, it's reflective of our situation, is that the classification, that is, what is the status of the employee going to be if they find one as the health coordinator? And I believe it's the class is either number 11. It's just one step above basically a professional. I want to emphasize this. It's one step below a professional. So if you, I don't know how many of you saw or turned in the request by the HR department on how you saw this particular position, how it's going to be treated, what we wish to achieve with it. I don't know what the results of that were, but I do know that from the paperwork that I did see, that the people who did submit their evaluations specifically said it had to be someone at the professional level, not at the sub-professional level. The reason for that, I have no idea why. It reflects a different pay point. It may be reluctance on the part of the town to spend more money on it, in which case we'll get what we just, you get sort of what you pay for kind of thing. Well, so we have this memorandum of understanding revealed a lot of, shall we say, issues that we have discussed and voted on. And the town is finding it difficult, I'll say, to be kind about it, in basically implementing it. Now, I do know that is my understanding that the town's moving ahead to enter into negotiations with Neshoba to extend our contract with them, our relationship with them for at least 6 months, if not more.
6 months with a 6-month extension after that.
Right.
Yeah.
Yeah. Which
I think is probably a very good idea and probably needs more. Because the more I see, the more I want to separate now my view on this, not necessarily what the process is that for the next two to 3 years, it's not clear to me that we'll be able to, as it were, successfully carry out public health operations either at the level that we're thinking of hiring and how things are going to be covered. In other words, we're in between still being a small town and being large enough where it needs a staff, as it were. So therefore, Neshoba, from an economic and management point of view, is probably still a good option as long as this board takes on more responsibility actively in providing direction and supervision to Jim and his colleagues. Which had never, until recently, I don't think it's ever been discussed,
Right.
much less done.
Right. And it's a revolving
So-
board, and you never know who's going to be on it down the road. So,
But it has to be, it has nothing more to do with the fact that it should be, quote, one of the responsibilities of the board to determine, to make it their business to provide policy and guidance, not necessarily to dictate to Jim or anyone else of how to do things, since they're supposed to be the professional, but to make sure they get it done in a timely manner and have a mechanism set up so that we can do what I would call quality assessment and control, so we can provide feedback. And I think that should be at least the responsibility if we're operating even for another 6 months with Neshoba, much less a town employee.
well, I think that points out some of what the Memorandum of Understanding lacks, in the fact that, it should be the Board of Health that provides guidance and oversight in a big picture way to the public health coordinator. I think that it should be phrased as, the Board of Health or its designee, depending on the appetite of the board at that time. I did have a conversation with HR. This position hasn't been graded yet. I did suggest a grade of 12, which would give that person the ability to basically be a senior management professional, and where they would be, held accountable for certain action items and not have to be micromanaged, and the board would not have to manage a day-to-day position, but on bigger picture oversight, the board would be, responsible for making sure the town's being served well in regards to public health by this person. So I feel that once everybody has a chance to review the Memorandum of Understanding, I can forward a copy over after we get out of our meeting tonight, so everybody can read through it. Michelle Vibert, the HR director, is meeting with the Personnel Advisory Committee to work on grading the position. And I think things are potentially shifting with the restructuring of the Department of Land Use as well. So this is probably a good time to have this conversation. But I feel at a grade of less than 12, where the person needs to be overseen by someone that's not on the Board of Health, or to be overseen by anything but the Board of Health, doesn't make sense, as this person is reporting directly to the Board of Health. So I just wanted to put that out there.
Would it be helpful to that committee in HR for one of us to be invited to that to help out?
It probably would, yeah. And I'll respond to Michelle and Vibert and see when that meeting is, and see if we can at least get a two members from the Board of Health to attend and let the voice be heard, since we're the ones that are responsible for it. So does that all sound like a good plan?
The only issue, not the only, but the issue here also is that there is a certain segment of work having to do with Title V that has, to which I'll call it issues about building permits have great sensitivity. So the result of this is that the interests of what we'll call the building part, the building construction part, and property issues, property opportunities in town have a different point of view about what is important and what isn't important than what Title V is about. In other words, it's basically you got to fulfill it, but do it as quickly as possible and let's get it on with it. So it's an issue of time and money, and as opposed to, as it were, time well spent making sure that we don't, have a neighborhood or a singular problem, health problem. So that's another reason why we should proceed with caution and thought about how this professional gets, or this employee, whatever it ends up being, who is in fact the voice in the ear of the employee.
Well, I think in any position, you have certain responsibilities. In the public health coordinator position, one of the major responsibilities is handling all things related to Title V, handling all things, public health related in regards to land use. So, it would be a responsibility of this individual to, have a weekly, if not, a couple times a week meeting with the building commissioner or the head of the land use department to make sure all the needs there are being satisfied. Things need to work in tandem. I think a requirement would be to, meet once a week with elderly human services, and make sure everything in regards to moving things forward in the world of public health is happening. Mike, I think you've made comments in the past in regards to, I don't want to quote you, but it's something in regards to networking, with folks at the state level and the regional level, to create more of more synergy and create opportunities and look out there for things that we can do to help better the public health program in Littleton. So I think there are a number of responsibilities, and we need to hire the right person and give them the right grade so that they are of the quality of person who can manage themselves on a micro level and get these things done. And then on a macro level, the Board of Health can certainly have updates at their monthly or bi-monthly meetings to make sure those things are getting done on a bigger picture level. That's how I envision it.
Well, I'm glad to hear that, because you're envisioning a much more proactive role for the Board of Health to take responsibility for what it's supposed to be responsible for. And number two, your picture of who of the position pretty well matches what I think the town needs going forward. Agreed.
Okay. So I'll send out this memorandum of understanding so everybody can take a look at it and read it. And then maybe at our next meeting on the 23rd, we can, if we can pass around some edits before then, and then maybe we can kind of try and finalize something so we can get it in place on the 23rd. That'd be.
You also should include just a suggestion. You may want to pull from the employees, the Littleton Employees Handbook always has updated table of a class and state of each of the status of employees.
Mm-hmm.
So I can. It's definitely not 12. Let's put it that way. The coordinators is at the best 11, which is below a professional.
Town planners 11 and building commissioners at 12 right now.
Right.
I think those things it's in flux because it's shifting with the restructuring of the department.
Yep.
Hiring this public health coordinator might be a big piece of that restructure. Things
agreed.
So that's that.
No, I'm just saying this because there are references in the Memorandum of Understanding, for example, to the Massachusetts, basically the regulation of the state that are not correct. There are references to the status of what the employee would be, and that's not necessarily correct. So that Memorandum of Understanding is a real draft.
Mm-hmm. Preliminary. Got it.
Very preliminary.
All right. So any other comment on that? Correspondence. I don't think we had very much correspondence at all this week. Does anybody have any? No. The minutes for February 23rd, 2022. Did everybody have a chance to read those? I have a couple comments on them. In regards to, where was it? So Mike and Dan, we had a public hearing for 27 Maplehurst with Civil Solutions. Kevin Ritchie was there instead of Kirk this time, and Kyle Mann, the homeowner, was there. And, you know, my comment on, Jim suggested that there be treatment before the leach field on this geomat system, primarily because of the I don't want to say the proximity of the wetlands, because it was outside of the 50-foot buffer, but because of the general area in the neighborhood, it being close to Long Lake, it being close to not only wetlands, but maybe a stream. I don't know if it's vernal or intermittent, but I think that, you know, the right call was to require treatment prior to the leach field. And if we had voted to do that, it would have set a precedent, because these things have been approved. There, I don't know how many of them, but they have been approved in the past without treatment if it's outside the 50-foot wetland buffer. And I think we need to have a discussion and a conversation about, you know, how much do we want to protect the wetlands and how much do we want to protect the environment and the aquifer and the drinking water. So anyway, I got off track. I requested that we have a discussion about this and it's not in the minutes, Janet. So I just wanted to make sure that it said that Baker requested a discussion and a discussion regarding innovative alternative systems with treatment inside of the 100-foot wetland buffer being required in Littleton. Because the problem is, like, Jim knows this area like the back of his hand, and he can go to this neighborhood and say, yeah, but there's that stream down there. Or he can say, yeah, but we know the soil changes 2 blocks away. So, you know, we want to be careful with this. When we get somebody new into the picture, they're not going to know any of these intricacies. So I feel like this board needs to take the step of, you know, taking that sort of advice from Jim. You know, even if we can't implement it on a one-time basis because the precedent's been set and this particular homeowner has actually installed these systems right down the road without treatment, but Jim feels in this instance it needed treatment. I think it would be wise for us to discuss a potential regulation that would require treatment on these new geomat systems when they're within the 100-foot wetland buffer. So I think we should discuss that. There's going to be a lot more of these systems coming up in the near future, especially as, you know, all the old ones get replaced. And I think it'll benefit the public health of Littleton. So I'd like to add that as a discussion.
I was thinking about this as well. And maybe part of it for me was saying, you know, something where it's when the list of variances themselves starts to get longer, that should also be a flag that maybe gives us some wiggle room, or maybe we have to, you know, discuss it further and say that, you know, maybe that's justification of enough when you're asking for 4 variances on the
Yeah,
single.
3 used to be the limit. Like, more than 3 variances never got granted, but no one pays attention anymore. So it is what it is. So I think we need to pay attention to that and having a regulation in there so we just have firm ground to stand on. Because when someone comes to us and says, well, you approve this one over here and you approve that one over here, and those are the same scenarios, why do I need it here? Well, it's because Jim thinks so, but that's not concrete enough to actually make it happen. So having something concrete in black and white will certainly help make our jobs easier and also make the engineers' jobs easier, because they know exactly what they have to do. You know, it's not a case-by-case basis anymore. It's just, this is the rule. That's what you got to do. So I had that comment on the minutes, and regarding residential trash haulers, Janet, Jim, it wasn't that Jim was going to ask Harvard for their regulations. Jim was going to gather feedback on the implementation of the regulations in Harvard to help guide Littleton in adopting new regulations. And I know all that, those things moved pretty quick because we just continued them, but I just wanted to make sure that was on the record. Does anyone else have comments on the minutes? So with those adjustments, I'll make a motion to approve the minutes of February 22nd, 23rd, 2022.
I second.
Roll call vote. Gino Fratelloni,
Yes.
Dan Kane,
Dan Kane abstains.
Matt Wason,
Matt Wason, yes.
and Mike Zeldin.
Abstain?
Okay, Kevin Baker votes yes. And any member updates? Comments for discussion?
I had a question on correspondence.
Yeah.
Just when we get reports from wastewater treatment and the report says that there is certain work that should be done, do we have a follow-up mechanism for that?
Assuming Jim gets those reports and has communication with the agency that is doing the testing. Janet, can you confirm that?
Yeah, that's correct. So he typically receives them at the same time I do, but I do send them to him when I'm sending them to you just in case, and he does follow up. It's really just an FYI for you folks, but he is responsible for the follow-up. I also send them at the same time to Corey over at the water department, so he's keeping tabs on it as well.
Great. Anyone else?
Just the exciting news that the first signs that the sewer program is moving forward. I'm sure all of you saw the copy of the first steps taken. So we're getting closer to shovel in the ground. 21 years later, yes.
21 years, wow. 21 years and
Plus,
$20 million. That's what it is. $20 million more than it would have cost if you did it 20 years ago. That is.
at least.
All right. Well, I guess then if that's it, all we need is a motion to adjourn.
Motion to adjourn.
I'll second.
All right. Roll call vote. Gino Fratelloni,
Yes.
Dan Kane,
Dan Kane, yes.
Matt Wason,
Matt Wason, yes.
Mike Zeldin,
Mike Zeldin, yes.
and Kevin Baker votes yes. Thank you guys. See you
Thank
in
you.
2 weeks. I'll send a bunch of